Hello everyone and welcome back to our channel. Today we are going to discuss a much requested topic by our students and parents alike, healthcare systems outside India. Navigating the healthcare system in a new country can be challenging. Today we will cover all the information you would want to know regarding accessing healthcare services outside India, getting a health insurance, some quick tips to keep in mind while selecting one, and also how can an international student manage medical expenses. So without further ado, let's get into it. So today we have with us Jafar, who's going to answer all the questions that you have asked us regarding healthcare systems outside India. So, Jafar, the most important questions and most common question that the parents have asked us and also the students is understanding how the healthcare systems in India is different from those that is outside India, specifically in countries like the US and Canada. Can you shed some more light on this?
Well, Gundeep, I think it is crucial that we understand that these systems, healthcare systems, are different in countries such as Canada, UK. While they might be, divided into two parts, which is public and private healthcare providers, but for an Indian international student, they will have access to both public and private healthcare services. But the biggest factor is the cost. The private sector again is going to be very costly, and public sector is going to be minimum or have no cost. And a lot of it would also depend on the type of health insurance coverage that you get and the type of country that you are going to.
Jafar, could you also give an example of public and private within the Indian context? Because some of the terms that you might have said, some people might not be aware about it.
Well, in Indian context, we can take examples of AIMS and Safdarjung as public healthcare systems, managed and funded by government, while private hospitals or healthcare systems would be hospitals such as Max, Fortis, funded by private institutions or private individuals or by equity, as we see. The major difference between both these healthcare systems would be the kind of cost that you incur, the kind of service you get. In private, you have access to healthcare services faster because there are not a large number of queues. While in public healthcare systems, you would have larger queues. The system kind of replicates in other countries such as Canada, US, as it does in India. So that would be the main difference.
So now that we know about the differences between public and private healthcare providers, can you also talk about how can an international student access these healthcare providers as well?
Well, the healthcare system in a different country would be different from India or from what we are used to here. In most cases, you will have to register with a local doctor or go to a clinic to access these healthcare services. You can additionally reach out to your college or university to get a recommendation of what kind of doctor you can go for. And similarly, web and apps are available if you want recommendations. One key thing that I would point out here is that a lot of these countries would have a referral system if you have to go to a specialist. So if you have to go to say go and see a doctor that specializes in bone or issues say with the stomach, so you will have to go to your primary care physician, get a referral, and then go there. You can't go to a specialist directly in a lot of countries. That might be the case.
So you mentioned about public and private healthcare service providers, specifically private when we talk about, they're very expensive and cost is a major consideration of students starting abroad. How can one start managing or navigate their way around costs?
Well, it's I think it's important for Indian international students to understand kind of healthcare system their host country will have, and to have adequate health insurance coverage to ensure they can access the necessary healthcare services without facing significant financial burden. See, for an Indian student, it is going to be a costly affair already. Going out to another country, which is more expensive. They don't really have jobs, such high tuition fees. Healthcare could add a lot on that financial, aspect. It could really cause a burden. So, for example, if you're in a country with limited healthcare services, especially in rural areas, students sometimes might have to take, journeys from smaller cities to larger cities for treatments. That could be a, one big example could be a dental, healthcare services. For example, they might be based in bigger cities. Some surgeries might happen only in bigger cities. So if you are in a rural area, you will have to take care and research properly where you're going, what kind of accessibility do you have there.
The next question is something which is interesting because when we talk about health insurance, we Indians have this chalta hai approach, right? Uh, Very few percentage of urban Indian population is covered under health insurance. So, do you think is it mandatory for people to take health insurance specifically for international students who are pursuing their journey in countries like US, Canada, UK, etc.?
Depending on the country you're studying in, you may be required to have an health insurance, in order to obtain student visa, which makes it a compulsory thing to have. In some other countries, it might not be required, but it is strongly recommended because you never know what happens and you might have to go for, healthcare. Uh, Talking about healthcare insurance, make sure that you have a plan. You understand the terms of the policy. You understand what services are covered, what are the deductibles, and if there are any inclusions. Sometimes pre-existing conditions or diseases are not covered. Factors such as if you smoke, it affects your insurance coverage. It affects how you will be getting the services there.
So, what are some quick tips from your side that an Indian student should keep in mind while selecting a health insurance plan?
Well, some real quick tips, when you or someone who's a student looking to get an insurance plan as a student, is check the country and the university requirements. What is it that you really need? When you're looking at the plans, always compare them, have multiple quotes so you know what you're getting into and you have the best options. You can save a lot of cost there. Understand what is covered. A lot of insurance policies might not cover XYZ illnesses. They might have clauses. So please ensure that you know what those clauses are, what is being covered and what is not being covered. Know your cost, obviously. What are you going to pay in premium? What are you going to get? And be aware of restrictions. Sometimes these insurance policies will have restrictions. For example, you can get only first aid, but not really a remedial surgery in case if it is required. So these are some of the quick tips. We will link more tips, towards the end of the video. You can have a look at them.
So, now you've given a few quick tips about selecting a health insurance plan. But are there any specific pointers related to the Indian community or the Indian students should keep in mind while selecting a plan? It would be really of great help for a lot of our community out here.
Depending again on the country that you or a student is traveling to, there might be or there may be some specific healthcare requirements. For example, there may be a need of specific vaccinations or medications that are not commonly used in the country. That they're going to. One way to kind of ensure that you are covered is to talk to your healthcare provider and ask, if you have any special needs and how you can deal with them. The other thing I would, really focus on is, there are some considerations that you will have to take care of as an Indian international student. Uh, One is mental health support. Indian international students sometimes or most of the times may end up experiencing stress coupled with culture shock while studying abroad. It becomes very important to seek mental health support, when required. They could look at counseling services or support groups. One of the important aspects that students also face is homesickness, which is quite common and can become a concern. So it becomes important that they take care of their mental health too. uh, the other is, again, I've talked about this, but insurance coverage limitations. Indian students should be aware that their insurance coverage, if they have any limitations, what are those, and if there are any exclusions. uh, like I gave an example, sometimes they would not cover pre-existing conditions or certain medical procedures. uh, I think these are the few quick tips that I can share.
So, thank you, Jafar, for answering these questions that were asked by our community. Well, we certainly have a lot of insights on how Indian international students can navigate healthcare system in a foreign country. We hope you found this video helpful. If you have any questions or comments, feel free to leave them down below. And don't forget to subscribe to our channel for study abroad related content. We will see you in the next one.